Welcome to our practice. I'm Dr. Bradley Willcox. I've been practicing dentistry since 1987, and I've been in Arizona since 1988 when I moved here and opened up AccuCare Dental Centers. The practice has been here a long time. That longevity shows we've been here a while and we're going to be here a while longer. You can count on that. In healthcare, our job to the patient is to find out what's going on and give them the choices that are available. So we need to gather all the proper diagnostic data, analyze it, and come back to them and then let them know what their choices are. The choice of what the patient does is always up to them. However, we have seen almost everything before, and we can guide them and let them know how other patients have responded to the treatment and help guide them to make the best choice for themselves. We see patients from usually 3 to 4 years of age when they start having their posterior molar teeth come in, and we see them all the way up until 100. Our doctors here at AccuCare are well versed in all phases of general dentistry. I myself have a special interest in oral surgery, that's extractions, implants, and such. We do also have a fine team of specialists that we team up with when patients need that. We really try to take care of patients. We like to treat them like family, treat them like we'd like to be treated ourselves. In general, we have a conservative nature. We are not very aggressive with things. We want to treat things the easiest way. We want to solve problems the easiest way. We are very thorough, though, in our diagnosis. We like to get all the information and ultimately give the patient all the tools they need to decide what's best for them. I'm Dr. Brad Willcox. I've been practicing dentistry since 1987. I grew up in Oregon. I have my undergraduate degree from Oregon State University, go Beavs. Went to Oregon Health Sciences University, that's in Portland, graduated in 1987. After that, I went into public health service, Indian Health Service branch, and then I moved to Arizona and started AccuCare Dental Centers. I've been working here as a private practice dentist since then, and also I work as a dentist with the United States Navy Reserve. I became interested in dentistry partly because my father, he's a dentist, and I'm the oldest brother, and my 2 younger brothers are also dentists themselves. One thing I like about being a dentist is that I can see clear and tangible results of the efforts that we make on behalf of our patients. We can see how things have improved. We can see how the patients have the new smile so that they're able to do the things that they want to do. We actually get to see that we've made a positive difference, a positive change for people. We get to help patients out. We help them with their problems. So it's very rewarding that way to see the fruits of your efforts immediately, and you just can't beat helping other people. When we're restoring a tooth that has a cavity, a broken filling, a fracture, sometimes the tooth needs more than just a filling. If so much tooth structure has been lost, it needs what's called a cap or a crown. Traditionally, crowns, when they're done, impressions were taken and crowns were sent out to laboratories. Now with the technology we have here in our office, we can do same-day crowns. The traditional way of making crowns, when the crown went out of the office, for that 2-week period, no adjustments could be made. However, when the crown is done in the office, now adjustments can be made as the crown is being manufactured. We have various checkpoints where we can check and see how things are going, and if we want to make changes, we can make them during the procedure. That allows us not only a more accurate and more precise crown, but a crown that just in general, it fits and is more pleasing for the patient. Many patients have had crowns before made the traditional way where the crown was made in a lab. They come back 2 weeks later and they get their crown. When patients who have had that done in the past come in and see the new technology that's available to them here at our practice, they are amazed. Not only the accuracy, the precision of the crown is better, but they really appreciate the fact that in one visit they get their crown, they get their tooth taken care of. The visits for same-day crowns are a little bit longer because the crown is made here, but it's all done in one visit. The patient only needs to be anesthetized one time, and they walk out with their crown. We understand at AccuCare that a lot of patients are apprehensive about having their dental treatment, and many of them don't realize that there are sedation options. There's take-home options and there's in-office options for sedation to help them through. Obviously, when they are here, we treat all our patients with the utmost respect, kindness, and concern for them and their oral health care. So we usually try to bring the conversation up with the patient just to ask them how they feel about it, to see what we can do to make their visits more pleasant. So there is no fear to ask about sedation or to express any of your concerns with us. We're here to help. Sealants are a protective coating that go in the grooves, the pits and fissures of teeth. It helps protect them from decay. So sealants are an incredibly strong way to protect teeth. They're also a hedge against costly or invasive repairs to teeth that might decay later on down the road. The sealants go in those deep grooves, and then the food can't get caught down in there. When the food is caught down in there, it leads to cavities, decay. So we like to put sealants on all grooves that will hold a sealant. Most patients get sealants placed when they're adolescents, when the teeth first come in, but we also put sealants on adults too. The protection is still the same there. Once we put a sealant on a tooth, they are a member of our sealant club. Basically, we offer protection for that tooth. If it ever gets a cavity or decay underneath one of our sealants, we'll fix it for free. All the patients need to do is they need to come back every 6 months so we can repair or replace the sealant. We check those on your 6-month recall, and as long as the patient makes their 6-month recall, their warranty is in place for their sealant. They have guaranteed protection. Whitening has come a long ways since I first became a dentist in 1987. The sensitivity that people had is virtually eliminated. Even so, we do have different gels for people that have sensitive teeth. Take-home trays are the gold standard in teeth whitening. There is in-office whitening. For example, if you're going to a wedding this weekend, you want to do that. But even so, with that, we still do take-home trays with those patients. Now, what goes into take-home trays is individualized for the patients. Most people do have the standard gel, but for people that have sensitive teeth, there's different gels for those people. And then for patients that have difficult problems, there are other products that we have had good success with. Whitening also with the take-home trays has the advantage of you can do touch-ups. I myself, every 2 or 3 months, will do my whitening trays for a session just to keep things the way that I like them. One of the things that's kind of surprising with the whitening is that most of the patients that are whitening their teeth already have fairly white teeth to begin with. But there are a lot of patients that do have intrinsic deep stains in their teeth, and what's kind of exciting there is that new technologies have come out in the last few years with the gels that work in the whitening trays, the same whitening trays, but we've been able to get some results with those people that are very excited about it because they tried before, things haven't worked out, and now we found a way to help get them closer to the point that they want to be at.